Welcome to the Salt Health Podcast. This month's edition is going to be incredibly exciting. We have special guests. This is the Men's Health Podcast. So as we do our introductions today, you'll notice no ladies allowed. This is the men's group. We're going to talk about all things men health, exciting topics to hopefully reach and connect our audience. And hey, don't worry, ladies, if you're out there and you want to listen as well to help get your significant other, your man's life in check. Let's go check out some good health topics and tips. Welcome to the Salt Health Podcast. So today I have great guest, Jacob Ponder, nurse practitioner, Tim Steen, registered dietitian, Tim Hunt, our director of operations. Guys, welcome. Let's have some fun today.
Thank you.
Welcome.
Do we need to high five or spit or anything like that?
Yeah, I thought about bringing coffee or whiskey or steak, something to be man, we're gonna have a real men's health discussion.
Yeah.
But here I am with nothing. We had some bottled waters.
It's fine. Yeah, it's hot outside. Stay hydrated.
And it is midday, so it's not like we could
right,
go all out. I'm pretty sure we're still going to see patients later today. I don't think that would be appropriate. So, but it was a good idea. So Jacob, start. Just tell us a little bit about your role at Salt Health, how long you've been in medicine, and why you're excited to talk men's health today.
Sure. So I've been in practice for a little over 10 years. Board certified in family practice, nurse practitioner, doctorally prepared, and functional medicine certified practitioner. I've been with SALT for a little over 4 years now, kind of bridging the gap between traditional primary care and functional medicine.
Yeah, it's awesome. I love that it's been 4 years.
It's gone fast.
I love to tell the story. I remember interviewing Jacob early on and just having that gut feeling and knowing that he'd be a great fit. And so it's been terrific to have Jacob on the team for these 4 years. Next, I'm going to introduce Tim Steen. Tim is, the next Tim also, both have been with us since the very beginning. So that's been an exciting, journey as well. But Tim, tell us a little bit about your role at SALT and also why you're excited to be here for men's health topic.
Yeah, so I'm a registered licensed dietitian. I've been that way for the past 6 years or so. I graduated from the University of Arkansas for Medical Sciences and got my master's degree a year or two ago. And I've been at SALT since the beginning, like you said. 2019, we started seeing patients. And, I think that men's health is very personal to me because that's part of the reason why I got into medicine, the medical field in the first place, is to help people live longer, healthier lives so they can be there for the people that they love, be there for their families, just personal connections to people that you lose too soon. That men's health is definitely one of the drivers of why I got into this field in the first place. So
yeah, thanks for sharing. And another just quick story, when Dr. Herbst and Jessica and I were brainstorming Salt Health and the vision around it, and what the practice would look like, what the full health assessment and array of services would be. We were all three in alignment and agreement that from day one we wanted to have a dietitian on the team. We believe that food is medicine. We believe that lifestyle, diet, nutrition, all of those things, movement, they all have a place in your health journey. And so we were just charged with, how do we get the right dietitian from day one? And we hit a home run. We're glad to have you on the team.
Well, thank you. I appreciate that.
Thanks for joining today. And finally, Tim Hunt. Tim, our director of operations. Similar to Tim, like I said, before our very first customer, before our first member joined Salt Health, Tim and Joy and Tim's team were a part of the Salt Health team. And have helped with a lot of the culture building, the vision, the growing of our business and our operations. So Tim, welcome, and tell us a little bit about you and why you're interested in the men's health topic today.
Well, like Tim Steen, the registered dietitian, who is, by the way, is just an awesome person in general, and we so respect and admire these guys, my colleagues. So, but like them, I have known many people in my peer group and associates that have had issues but never wanted to talk about them. In fact, I remember one person was going to church carrying a big box for a meeting that they had, and his chest started hurting. Well, later he shared that with me and said, I really don't want to tell my wife about it because because I don't want to be caught. And I said, well, what do you mean? They said, well, I don't want anything to be wrong with me. So basically what he was saying, if I ignore it, it will go away. And so because of those interactions over the years, we have become very passionate about functional medicine, about functional health, where we can attempt to find the root cause of things so people have better lives and better outcomes and affect generations that way.
Yeah, absolutely. Yeah, and I think that's so true. I think a lot of times we, the stigma is that the guys are worse about it than the ladies. But I mean, it goes both ways. I know plenty of women who are just as private or stubborn to say, I'm not going to go seek care, I don't want to know, or I'm not going to do that. But I do think, again, today our target with the men's health, let's hone in on that. I think that's a great segue. Is we often will get families who sign up as members at Salt Health, and a lot of times it'll be one member of the family who joins first, and then they drag on another member of that family once they see some of the engaging care and the great personalized attention that we provide at Salt Health. So Jacob, Tim, give me a story of where a family member came in and they brought a significant other, that was a male who came in and was like, oh my, I've never done anything like this. I've never tested these things. I've never really dove into my health, and to where you feel like we really made a difference in their lives.
Yeah. Well, I can't tell you several times that I've met with somebody who came in for a specific test, or we reviewed results and got him on a plan of some type, and they said, oh, my husband needs to come here, but I'll have to drag him here or whatever. And then they do, and then we have a great interaction and a great outcome. So it happens frequently without giving specifics. It happens all the time. And one of my favorite things is seeing the families that go to Salt Health and seeing the dads really engaged in the care of the family and, helping with the kids. And, it's not all put, on one person. It's a whole family. So seeing families at Salt is a great thing.
Absolutely.
Yeah. Similarly, a lot of times with first of all, we'll oftentimes maybe the wife and the mom will kind of start her journey with us at Salt, and over time there's a little convincing involved, I think, in getting the husband on board. And so I will often start off my new patient visits with, are you here on your own free will, or were you forced to be here? And they're usually like, I decided, I was listening and I wanted to hear what you had to say. So we do hear that a lot. I do think sometimes in general, which I want to dive into a little bit more, guys are a little more hesitant to start to dive into their health because we generally have this notion of well, if I ignore it, it will go away. Mm-hmm. But I've had several instances where the guy has come in, later than the rest of the members of the family, and he's just, a little very skeptical, not really sure what we're about, and we just go through our process and start getting information and gathering, and he starts to feel better, and we just kind of, monopolize on their optimal health. And over the time, they just see the guards down, the trust is there, and they're all in. And then the next thing you know, they're bringing other family friends in and other family members and stuff like that. So it's just really cool.
I love it. And the family affair, that's what makes it great. And I actually was doing a podcast as a guest with one of our members recently, and he gave the example, he's about 45 years old, that his son in the last 2 years has had more blood draws and medical appointments than he had in his entire 45 years of life. And so, having that connection to reprioritize and focus on health from a young age, I think we all are very passionate about as well. So let's talk about one of the major issues that I think everybody is always focused on health, but still the number one killer, especially in this part of the country, is heart health. And so cardiovascular issues. And so I talk to people almost daily who say, oh, I've never really had my heart checked out, or oh, my dad died at a young age, with cardiovascular issues. I mean, it's pretty common that they come in and have those conversations. From a clinical perspective and from an operations perspective, Tim, just tell me, if you were talking to someone who's not currently a member at Salt Health and they said, I've never had my heart health checked, or I don't have any baseline of what that would be, help explain why that would be important for them. And then we'll talk a little bit about maybe some of the services that we provide.
Yeah. Well, I think what I would tell them is that heart disease is a silent, threat in the background. You're not going to notice symptoms that, something's wrong until, it's an ER visit or something worse. There are some signs that you can notice a little bit beforehand, but it's generally, fatigue, some chest pain, shortness of breath. But by that point, cardiovascular disease is already so progressed that you could have done work 10, 20, 30 years before to keep you from getting to that point and keeping your vessels clear. So I would say you're doing the right thing by coming in and checking now. Like, there's no better time than now to get a baseline reading on what your cholesterol is, see if you have any inflammation going on. We even do an ultrasound imaging on the carotid arteries that you can actually lay eyes on the blood vessels to see if there is any plaque buildup or blockage developing. And from there, you can decide clinically what's the best course of action to deal with that.
Yeah, absolutely. Jacob, Tim?
My experience in the conventional setting, even before I kind of dove into functional medicine, is that it's really geared to catch things after they've started or after they're symptomatic. And that's where functional medicine and Salt Health really sets itself apart. Is we're looking for prevention, we're looking for optimization, we're looking to catch things either early on in the process or even before that. And the problem with a lot of the cardiovascular diseases is, like you were saying, they are very silent, so you don't know that they're creeping up on you. But a lot of times they're just lifestyle related, making poor choices even when we're young with the foods that we're eating and our lack of inactivity and things like that. And then we get away with stuff. I feel like men kind of get away with things a lot longer than females do, just by nature of we don't have to go through a lot of the hormonal changes they do at an early age, and we're not experiencing. We don't have the gift of bearing children and things like that as well. So we just kind of sit back and wait to be told what to do. But there's no one out there really telling us what to do or when to do it. And as far as cardiovascular screenings and things like that go, there aren't really set guidelines on when should I start getting my cholesterol checked, or when should I start thinking about plaque buildup, or whatever it is. And so that's where there's really no hard, fast rule on, the earlier the better, the more that we can prevent the better. And so I think that that's a lot of the pitfall of men's health in general, is we're not really being told when to do things. But we can start at, any age essentially, and get a baseline risk and then go from there. Or sometimes we are able to catch things kind of in the process and really develop a plan that's a little more aggressive in kind of remedying the risks that they're already suffering from.
It's actually a real good point. I don't know that I've ever really stopped and thought about that, but at 45 now, people, physicians recommend, getting a colonoscopy, screening, obviously, a prostate check for men, and, for ladies, maybe an annual, GYN appointment and things like that.
Cervical screening.
There really is nothing like before you're 40 years old, let's say, where you're like, this is the recommended check for anything in a man's health, but specifically in cardiovascular. And so again, when you're talking about something that is so widespread still, and cardiovascular being such a concern, you would think there would be some sort of protocol or recommendation to get a baseline screening of your heart health. And I do think that's why our heart health package has been so amazing, because we obviously, our members kind of get the full array throughout membership of getting, EKGs, variable heart rate monitors, getting the opportunity to get the carotid artery scan that Tim mentioned. But one of the things is the cardio IQ. And I know we kind of call it that internally, but it's an advanced cardiac panel. And Tim, as a patient, even kind of tell what it was like to get the results of a cardio IQ lab, and how did it help give information to you?
Well, first of all, it's an in-depth, executive, high-level, deep dive analysis of the picture of my body today.
Yeah.
And it gives such great information, it's just amazing. Now, you have to overcome the fear that it's all going to be red and bad because there's green, there's yellow, and there's red.
Right.
And so you have to overcome that. And that's a little joke, but also some serious in there too, because I would rather have the data now and be able to react to it and not just react, but also respond to it and take action steps to be more healthy, because I want to live a full, healthy life. I don't want to have a long, protracted disease. I don't want to die too early. I don't want the finances to really impair my life, because I'm spending all of my money, or most of it, on trying to get well because I didn't take care of myself.
Right.
So at any rate, so the data is just amazing to me, because then you can take action steps, and then over time I have seen those numbers improve over and over and over. And then your genetic age, your actual age, continues to go down, which is different than your chronological age.
Yeah.
So
Well, Tim and Jacob, you've both probably at this point, not hundreds, but into the thousands of interpreting and reviewing cardio IQ labs, and also just all related functional medicine approach to heart health. So, not to get too technical with our listeners, but at the same time, I mean, maybe describe how we approach it differently from a preventative standpoint, and also what information we might uncover that would be useful in changing behaviors, lifestyle, or medication.
Mm-hmm. So my approach is, generally I like to start with diet and lifestyle first. When we get that first report back, looking at your cholesterol, and we'll work on that for 3 or 4 months before we recheck to see if that's enough to get you into a healthy range, if it's a little bit off. If your numbers are a little bit, more dramatic, out of range, there are some natural options, some, over-the-counter things that you can try. There's just a handful that have been shown to be effective in trials. And then beyond that, there's medications that you could also consider. But I like to start with diet and lifestyle, because why not try that first? And if you're coming in early enough and I don't see a lot of inflammation, but your cholesterol's high, you appear generally healthy, we're definitely going to talk about diet and exercise, because that's number one. But on that second test, let's say somebody did everything right. I worked out every day. I walked after every meal. I ate 30 plus grams of fiber a day most of the time, and I'm just doing everything you asked, but their numbers are still high. There's that pride component that men have. It's like, well, I did everything right. Why is it still, out of range? Well, genetics plays a huge role in determining what your cholesterol is going to be at a baseline, and diet and lifestyle can affect it somewhat from that baseline, and we'll do the best that we can. But just that education of how different factors that are outside of your control affect your cholesterol levels. It's not everything that is on you as a man. Sometimes we feel like we're responsible for every little thing about our lives and the details, but that's one of the barriers I often deal with. It's fear. Tim talked about the fear of getting the results back. There's pride is a big barrier for men, and then there's ignorance is also part of that too. Just not knowing what I need to test, when I need to test it, what do I need to check, what I need to be aware of. I don't think I had a regular primary care doctor in my 20s, let alone my 30s, but how many men do? So a lot of people, by the time they get into the doctor's office, they're already 10, 20 years down the pipeline of having high cholesterol. So get it checked out when you can, and come try our approach to it and see if we can get you working together to get it improved. But I like to see a complete transformation in a little less than a year when it comes to cholesterol. We do trial and error on the testing every 3 to 6 months until we find the right combination of diet, lifestyle, over-the-counter medications that can bring your numbers into better alignment and greatly decrease your risk over time. So, yeah.
I use myself a lot when I'm trying to educate patients on what the cholesterol test does, the advanced panel does. And you know this very well because we were just by default checking my cholesterol, and I really don't have a family history of heart disease, so I wasn't really concerned about it. And I eat fairly well and stay physically active, but my numbers were increasing, and you and I were kind of spot checking stuff, and I was even changing the types of oils that I was using, thinking, well, maybe it was the high heat temperature. You know, we were like going a little deep into it, and then we decided to go ahead and check my genomics, which is, you know, kind of the variations in my DNA that may be contributing to my numbers increasing. And we found out that my body genetically takes good cholesterol, HDL, and turns it to bad cholesterol. And so I'm working uphill. I don't really have any control over that. And so I would have never known that had I checked into my genomics testing, but it allowed me to kind of step back a little bit and realize that there are certain things that I can't control. I do want to prevent risks. There's a chance that I would never develop cardiovascular disease. However, I am going to be a little more aggressive in my approach, knowing what I know now. And that's a lot of times a combination of herbal medications, obviously even more lifestyle changes, and then, when necessary, medications. And that doesn't necessarily mean a pill every day, but maybe it's 3 days a week or something like that. But just as little as we can do to limit our risks, I think, in the long run. It's not bothering me right now, but I can't tell you what it's going to do in 20, 30 years from now. So I'm going to use the power of the knowledge I have and kind of lower that risk a little bit.
So when you have diet, when you have exercise, and then you have genomics, why wouldn't a person control the things that they could control and then address the genomics like what you're talking about? Why wouldn't you do that?
It's a lot of information, and a lot of information can be overwhelming to people. And again, men, generalizing here, tend to not want to know until they start to feel like something should be done. So, and I before I entered the healthcare world, I probably thought that way too. Like, I just will pretend like everything is fine. I feel fine, so therefore it's got to be fine. And as we get older, things change, and we're not going to get away with the things that we were able to get away with when we were younger. So, I think testing is scary just from a truth is power or not. Financials, I think, also play into a factor. What can of worms is this going to open up, and what is that going to cost me in the long run? Well, it actually may save you in the long run.
Right.
It can actually be very beneficial to, catch things before you end up with hospital stays and specialist, copays and things like that too. So I think it's just a lack of knowledge and awareness.
One of the things I hear somewhat frequently is, I haven't been to the doctor in 5 years. Like that's a badge of honor. Mm-hmm. When your body has changed over those 5 years. And that's why I like to talk about the controllable things, because then I can put effort and action steps to that, which helps my outcome. But those are things I can do, because we do change over time. Everything physically, and our diet changes, and our metabolic rates change, and so I just see great benefit in what we do, because we get to see better outcomes all the time.
Mm-hmm. Yeah, and it's we're all guilty. I mean, I think the four of us, if we're being honest with each other, I mean, we're regular guys, and we had the same mentality and mindset that we're speaking to people about. I went long periods of time where I didn't proactively go work on optimizing or improving my health. It would, when I was sick, I would go to the doctor. And so, I think the comment you made, Jacob, is so true. You don't know it in advance, which makes it very difficult from a financial decisions to be like, well, I'm going to spend, $300 today on something. You can't directly tie it to that it'll save you $10,000.
The concept of investing in your health is kind of this like unfamiliar territory. And I think you've said it before best, likening it to car insurance, and the money that we can spend on the forefront is going to save us thousands and thousands of dollars potentially on the back end. And we invest in all these other things, but if we don't have our health, we're not going to necessarily be able to enjoy the other things that we're investing in. So why not start investing in prevention and wellness?
My wife likes to make fun of me, but I always buy good tires for our vehicles.
Yeah.
And she's like, why? And they're literally the only thing in your car that touches the ground.
Mm-hmm.
It's the only thing that hits the pavement, right? And so you can have a $100,000 vehicle and you got crappy tires, you're going to slide all over the road, and you're not going to be safe. And so I like the comparisons with auto as well. Tim and I have kicked around several over the years, and that preventative, proactive maintenance can lead to big savings of things not breaking down in the future or not sliding off to a horrible catastrophe. So, I appreciate the thoughts around the heart health piece. And it's something I'm very passionate about as well. Tim, I know that you are, and it's still such a challenge to convince people to take a look at their heart. Hopefully our listeners today have had the opportunity to say, you know what, I'm going to take the investment to go at least get a baseline and a bare minimum. For the first time, I'm going to get a comprehensive look into my heart health. So we don't care where you do that. Go get it done. If you want to learn about the Salt Health Program, that's great too. We believe we have an exceptional team and exceptional testing that can provide additional insights. But check us out. We've got a great heart health package in our precision packages online. The next thing I want to talk about is something that is like one of the hottest topics. You can't go anywhere without talking about it, and it's hormones. Or as some people would just say testosterone, but there's so much more to discuss there. But there are so many more options today than there were 10 years ago. People can, subscribe online and get testosterone enhancements or replacements, or, virtual appointments with people, or show up in, non-medical clinics and get, some testosterone treatments and different things. There's a lot of information out there. There's a lot of noise out there. But let's just start with the baseline of, how important is hormone health when talking about overall men's health?
So I think historically, hormone replacement has been a forbidden topic. There was, in the last few decades, probably some research that led to fears around hormone replacement. But we know that we've come a long way since then. We've started to dive in, looking at more bioidentical replacements, not looking at the synthetic things. And so we can find out that replacing testosterone, optimizing testosterone, is actually quite beneficial. Now, testosterone is a lot more than what we associate it with. We think of like bodybuilding, and we think of libido essentially. But when we are talking about testosterone at optimal levels, we're thinking about heart health. It can actually be very cardiovascular protective. It can help protect our prostates. It can help protect our risk of dementia. It can be an anti-inflammatory hormone. So there's a lot more benefit to testosterone than what we associate it with from the things that I just mentioned. Prevention, energy, huge game changer for a lot of men with hormone replacement therapy. Their sleep is better, their mood is more regulated. We're also able to hold on to muscle mass like we were when we were younger, preventing body composition issues and the things that go along with that, including osteoporosis. So that is in a nutshell the advantage of optimizing testosterone. There are safe ways to do it. There are unsafe ways to do it. So obviously we're going to focus on the safest ways possible, which are bioidentical. So compound for compound, testosterone can be made with what your body would make naturally. It's just we're working against time. So this is one of those things also where very rarely am I going to see someone with an optimal testosterone level after 40, even sometimes 30 and 50 and 60. There are the exceptions, and it's, we're very jealous of those people. However, other factors are contributing to our testosterone levels not being what they should be, just from a life. Our diets are horrible now, and that's impacting our gut health, which is then having a more upstream impact on our hormone development. Chronic stress, huge. Guys, working, fathers, all the things, the stresses that come with that can steal from our hormones. We aren't as physically active as we were because we're working all the time. We're constantly being exposed by environmental factors and heavy metals exposures and molds and chemicals and pesticides and things like that. And all of those things are preventing us from aging gracefully and reducing risk of all-cause mortality, cardiovascular being one of those hot topics.
That was a lot of wisdom you just dropped.
Thank you.
Man. So, I mean, I love it. And I think that overall picture, you answered better than I could have ever even teed up a question. But the bottom line is it's all interrelated. And so when you think about, the whole health, the whole picture, there's, as you said, stress, diet, lifestyle, exercise, all of those different types of things. So Tim, tell me, as you look at as a again big picture, you're meeting with our members, and they may be on a care plan that has lots of those things he just mentioned. Maybe somebody, it's heavy metals or mold or hormone or diet, or it's when you're taking in information and factoring in all of that, how does that help you to create a customized recommendation or plan that you have for your customers?
Yeah, well, all of the pieces of information that we get help us to customize a plan for our patients, and the hormone panels are just part of that. But from a diet standpoint, we know things that can affect hormone levels are especially alcohol and fatty foods, fried foods that are just inflammatory, overly processed foods, insulin resistance, that weight gain, the central adiposity that you start to develop around the organs, the fat that can really lead to more chronic disease. All of that can be improved with optimizing testosterone. It's not a cure-all. It's not going to be the one thing that does everything, but it's part of that puzzle that we have the ability to look into. So I feel like that's a piece of the puzzle that a lot of our members that come to us have been missing, just because hormones are complicated. It's complicated for me. I don't love the topic, but it is important. And so I'm just happy to be at a place that does factor in more pieces of the puzzle than most clinics are going to, and that's very important.
You actually answered it better than you think. It's coming to those deals. So I mean, I look at it as if I showed up and said, "Hey, I've got multiple things going on. One of them is they're checking my hormone health," and you're like, "Well, you're eating chicken fried steak and beer 3 nights a week." You would be able to say, "You know what? You can tailor your diet, and it could lead to and have an impact on your overall health, including your hormone health."
Right.
And so it's all interconnected and tied. And I think that's where, again, I love the team approach at Salt Health is, whether you're with, our health coach or our dietitian or our providers, you've got somebody who's looking at the whole picture and trying to say, well, I may not go fully into that, but I'm going to connect with Tim, our dietitian, and make sure he talks with you about, 3 or 4 things that could go even further hand in hand with this current protocol that we're working through together.
I think it's interesting too. We're touching on 2 topics and kind of correlating some misnomers. So when I think about hormones, we obviously think about testosterone a lot, but then risk of testosterone could mean potentially risks of being more estrogen dominant. And so people get a little uncomfortable whenever we're talking about estrogen dominance in men and women, but we're going to talk about men today because of the risk factors that it has on the prostate. So it doesn't necessarily, but you think, well, let me block estrogen and take that down as low as possible. And that's less isn't more and more isn't more. We are constantly looking at hormone levels and what our bodies individually are doing. Again, there are lifestyle factors that that correlate with what our body's going to do with estrogen. There are genetic factors that correlate what our body's going to do with estrogen. And so we're looking at all those things, offering potential dietary things, cruciferous vegetables, things like that can help our bodies process and eliminate excess estrogens. But we also don't want to drop it too low because our brains as men need some estrogen. Now, we don't need too much, but we also don't need too little. Similarly, with heart health, when we're thinking about cholesterol, a lot of times in the conventional world, it's let's put them on the highest dose statin and drop that LDL down as low as possible, and let's reduce as much risk of cardiovascular disease as possible. Well, hormonally, we have to have LDL to start that whole pathway of converting hormones. So if we're dropping that LDL down, we're setting ourselves up for failure from a hormone standpoint, and also we need the LDL. Our brains are mostly made up of fat, so we need some amount of cholesterol. We don't need to drop it too low, so we can reduce our risk of cardiovascular disease, but then we're going to increase our risk of dementia and not know that we didn't have a heart attack. So there's a healthy balance there between hormone regulation, cholesterol regulation, and optimization.
No, I love that. And I mean, it's, again, when you traditionally go to your physician or you go to your primary care office, you go for a single point in time reason. It's like, oh, well, I've been having sinus infections, or I'm worried about my, I'm having heartburn, or what. You go and you're attacking that specific symptom and that specific reason for the visit. But you, in a 5 to 6 minute visit, which is what an average primary care visit is when you're seeing 25, 30 patients a day, is you don't get to the rest of the things that interact and that align you for that, overall improved health. Another piece of that would be the digestive health. And so, I mean, if you're talking about a trio that we would say, what men, why would you come to Solve Health? That maybe another leg would be digestive. If we can help get you aligned in heart health, hormone health, and digestive health, how much better are these guys going to feel?
Right. A ton.
It could change their life.
Well, but I'm glad you brought that up, because let's suppose that you're a hunter or a fisherman, or you love sports, you love to kayak or hike, you love to play the piano, you love to play with your kids or grandkids, and anything else that you can even think of. When you meet with Tim and you put together a plan, which, by the way, I was surprised about how easy it was to implement his recommendations, because I actually thought, I'm never going to meet. I can't do this. He's going to have me eat broccoli pancakes, and I don't like those. And so I was really surprised about how much easier it was than what I thought. But let's suppose that you address your hormones and you get them to an accurate, good, optimal level, and you address your nutrients to where, and every other area of your cardiovascular health. And then when you go under stress, your body actually has reservoirs to draw on. But not just that, but then what I can do is I can continue doing everything I want to do in my life because I've addressed these three areas.
Yeah. And that's what it's all about. Is we want to be here longer for our families. We want to be here longer for our friends. And obviously community and relationships are a big part of that overall, health as well. But I love thinking about it as an alignment. It's like, if your car's out of alignment, parts of that vehicle are going to wear differently. And over time, you're going to have more and more problems. And so if you are someone who's not had the engagement of a primary care team and not had anybody looking at these things, it may again be overwhelming to come in and be like, if I get started, what am I going to find? But I promise you're going to be a lot happier finding it today than you will be in 5 years or 10 years, and it's going to be a whole lot easier to course correct today than it will be in 5 years or 10 years. And so let's just connect a little bit, because we are learning more and more as well about the tie-in with gut health or digestive health.
I'm going to say something, but this is really kind of your area of expertise, so I'm going to let you kind of drive it home. However, going back to what I was saying about we need some cholesterol to be able to kind of start that hormone pathway. We also need some estrogen for brain cognition. Well, a lot of those things start in the gut. We have hormone regulators that are in the gut. We also digest and metabolize cholesterol through gut, liver, detox, all that stuff too. So again, if we're going to think more upstream, what's the first area of that? It's going to be our gut health. And I think in the foods we eat, in the way that it digests and absorbs nutrients and gives our body the things that it needs so that it can produce hormones and so that it can regulate cholesterol and things like that. But yeah, I'm going to turn it over to you just because you deal with this on a daily basis.
Yeah, I mean, digestive health is a really important core part of what we need to focus on. And it's just such a big mystery to most people of like, what even is that?
Sure.
And basically the core tenet of gut health is that it can affect your immune regulation, inflammation throughout the body, not just in the gut, but in the brain. So having a microbiome that's out of balance, a lot of inflammatory bacteria, it can actually affect your long-term brain health if you don't correct that or work to get that in balance. And the things, of course, that we eat have to be absorbed and put into our body somehow, and that happens in the gut. So without our gut, we can't do anything, right? The majority of our immune system lives in our digestive tract because that's where all the bacteria are coming through, both good and bad. And so if you can get a check on that, which we're able to do with our testing, get kind of like a snapshot in time of, okay, how's my gut doing right now? Mm-hmm. You can adjust or balance it based on what the data is showing you that we need to focus on, including things like hormone metabolism. If you're not eliminating, if you're constipated and you're not having bowel movements every day, you're going to reabsorb a lot of the things your body's trying to get rid of, including estrogen. That's one of the ways our bodies metabolizes hormones is through elimination of stool, and then certain enzymes that are present in our gut as well help determine our hormone levels. And so it plays a huge role across all of our body systems. There's really not one thing that's more important than the other. So I would consider that it's often one of the first things that we recommend checking is gut health.
Right.
And people that don't have knowledge, that have ignorance, whether it's willful or not, they may not understand the importance of getting that checked at the beginning of your process at Salt Health, so that we can rule out some things and adjust things and make the other things we're trying to address work that much better and quicker and easier. So.
When patients come to us, initially we spend an hour and a half starting from the day they were born until the day that they're there today, getting a timeline of events that kind of are building their story. And we are gleaning in that information to determine what we kind of need to dive into first. And a lot of times, like you said, it is gut health. And often people don't feel like their gut is an issue, but we're also looking at a bigger picture, and they're having chronic headaches, or they're having skin issues, or they're having brain fog, or they're having all these other things. And we know from kind of the more upstream root cause approach, a lot of those are going to stem from the types of foods they're eating or the lack of nutrients they're absorbing or metabolizing or things like that. So just because you don't necessarily have gut symptoms, I feel fine, I get a little bloated, and I know that I don't do well with dairy, but I'll have dairy anyway. It's not a big deal. I'll get over it. Those are warning signs of a whole bigger thing that could cause multitudes of issues, not just in the gut, but everything from neurological deficits to hormone regulation to cognition. So,
one of the things I think that makes it hard with the digestive health is you don't think about it as much in hormone or heart health even, that you're going to have to necessarily make dramatic changes in your life with maybe your eating habits or different things like that. When you start talking about, well, I'm going to do some digestive health testing, and people are like, oh my gosh, well, I don't want to have to give up all the foods I love, or I don't want to have to completely transform. I see all these people who are gluten, dairy, soy, nut, everything free in the world, and I love food and I'm not going to be able to do it. One of the things I love about us again at Salt, and Tim, Jacob, and Tim, you as well, just in our conversations, but things are okay in moderation a lot of the times, and it's not going to become, unless you have an extreme case of an allergy or something else like that. So I'd ask you to just maybe hone in into tell a real world example. Is it okay if I occasionally have a steak? Is it okay if I occasionally have a whiskey? Is it okay if I occasionally have chocolate? It's not going to necessarily, just because you come get digestive health testing or look into your gut health, it doesn't mean that you can, you only have to eat, as Tim said, broccoli pancakes, whatever it may be. So kind of close out as our talk here is just how you can make lifestyle changes that are meaningful and effective, but it doesn't have to be a complete destruction of everything you've ever done.
Yeah, that's a great question, and oftentimes one of the biggest fears that people have is that I'm just going to have to live like an aesthetic. I'm not going to have anything. I'm just going to be eating salads and sardines. Not true, although those are good things for you. If you do 50% of the things, you're going to see 50% of the results. I mean, not exactly correlation, but sure. It's on a spectrum. You don't have to go all in and just be this perfect person. First of all, that's not possible and not realistic, not sustainable. But if you can make some small changes here and there and snowball that over time, give yourself a chance to make some new habits and patterns in your life, you're going to see positive changes. It's not going to be a dramatic, overnight instant change, but something that you can piece together. And if you come back with a food sensitivity test that shows gluten's not great for your gut, it's showing right here on the test. It looks like it's driving a high immune response. Well, you don't have to go gluten-free right then and there. You can just kind of dial back on it at first and cut back on some of the pasta and the breads that you might be having every day. Have it every other day. Have it just a few times a week, and gradually work towards that removal of the thing that's causing you problems. And I give you the education to find alternatives and to help you navigate the products that are available. And our health coach is great at that too, by the way. So just don't be afraid about what we're going to recommend. We're going to recommend something, obviously, but we give you the tools and the support to implement those changes.
That's a great point.
Yeah. I think one of the joys in what we do, in what I get to see on a regular basis, is learning to listen to your body. If you can learn your body, it's going to start telling you what it can handle and what it can't handle. And sometimes in the beginning, we are a little more aggressive of, well, let's remove these things that we know are probably causing some issues, inflammation, inability to detox and things like that. And then let's start adding things back one at a time so that we can start to, and it may take years for individuals to realize what certain one thing might do that another thing may do. So is gluten and dairy are the two most common, obviously, and it took me years to realize, well, if I overdo it on gluten, I start to feel it in my joints. If I do dairy, I start to feel it in my gut. And it just took a long time of process of elimination, listening to my body. Are those driving headaches? Are those driving skin issues? Whatever it is, it's a trial and error, and we're here to support. We're here to give you the information, support your process, and get you to learn your body.
So Jordan, I know that you're going to pardon me. I know you're going to summarize here for us. But what is the one step? What is the first one step if a person is out there listening to this, or persons? What's the one thing that they can start with, and what can they do?
Well, for one, is letting down your guard enough to actually say, my health is a priority. That I need to take care of myself to be better available and longer for my family, for those who care about me. I think that's kind of the first thing, is that self-acknowledgement of, it's worth an investment to get at a minimum a baseline of what my health is. It may not have to be a full comprehensive. We have an executive health assessment that is extremely comprehensive that looks at all arrays of your current picture and state of health. But if you just want to prioritize looking at your heart or looking at the digestive, then we have plans and resources that are available to that. And again, if you have a primary care that you work with, ask those questions. What I've never tested, to my knowledge, a deeper look into my heart health. What would be available to me? Being bold and brave to ask the questions and start there. I just want to encourage men to go out, be bold, and admit that your health should be a focus. It should be a priority, and that it's actually selfish to not take care of your health because you're not being there for your family.
If you feel good now, how can you feel good in the next 10 years, 20 years, 30 years,
absolutely.
40 years?
Right. Yeah. And I love, all of you kind of along this path today. It's more described as a journey. This is, we say live life healthy. That's kind of a motto we have at Salt Health. But you evolve, you make adjustments to your plan, you continue on that journey and make improvements. And I love the example you gave, Tim. It's like you don't have to, today from day one say I stop all of this 100%. But man, if you knew today that small changes would lead to a 10% reduction in a risk for heart disease, who wouldn't sign up for that?
Right.
Then you start making big changes, and maybe it's 50% reduction of chance, or 100%, 99%. And so as I look at this, again, I wanted today to be an encouragement. I want it to be educational. You guys are amazing. We have the best team at Salt Health. I love these men. I love every member on our team. We're truly blessed to be here in Northwest Arkansas and to have the best membership. Patients who are truly engaged in their health care and are proactive in that. So just want to say thank you to each of you, Jacob, Tim. Thank you all for being here today. Let's live life healthy, and thank you to our listeners. Check out salt-health.com. You can see our precision health packages or join our membership wait list, and we look forward to partnering with you. Thank you.
Thanks.
Thanks, guys.
All right.
Thank you.
Thanks.